This video presents the Rivermead Behavioral Memory Test 3rd edition. Our client is Mrs. Joan Mitchell, who fell at home 2 weeks ago and was admitted to a local hospital with acute delirium and a right fractured neck of the femur. She is 82 years old and lives at home with her husband Bill. At hospital, she was subsequently given medication to resolve her delirium and had hip replacement surgery. While reviewing her self-care ability in the rehabilitation ward, Mrs. Mitchell presented as having reduced safety awareness and poor new learning ability. As Mrs. Mitchell is presenting with cognitive deficit as well in the everyday memory skills of orientation to day and date and reduced immediate and delayed recall, it has been determined that the Rivermead Behavioral Memory Test be conducted with her to inform her discharge intervention plan. The Rivermead Behavioral Memory Test was originally designed to predict everyday memory problems in people with acquired non-progressive brain injury and monitor change over time. It identifies difficulties with memory that may occur in everyday life situations, as the assessment focuses on tasks which mirror everyday memory skills. The test can predict everyday memory problems, and results can highlight areas of strength or weakness which can aid intervention planning. The test is valid for ages 18 to 96, and adapted versions for children and adolescents are available as well. The kit includes 2 stimulus books, version 1 and 2, a message envelope, story scoring card, a novel task scoring card, an electronic timer, the novel task kit, 1 record form, and a manual. Additional material needed are a stopwatch or clock with second hand, a quiet room and table, and 2 chairs. Administration of the assessment. The examiner should be experienced in administration of clinical tests and commonly has qualifications in neuropsychology, occupational therapy, clinical psychology, or speech and language therapy. The test should be used with caution with ESL clients, and the root subtest can be adapted to compensate for physical impairment. Before commencement of the test, the client should be informed of the reason for the assessment, for instance, to gain an understanding of how their present everyday memory is working, and their consent must be established prior to proceeding with the test. Physical conditions. Distractions should be minimized, and the assessment conducted in a quiet, adequately lit, well-ventilated room free from distractions or outside interruptions, with no one other than the examiner and the client in the room. The client and examiner should be seated comfortably across from each other at a table, and materials should be arranged within easy reach, but with those not being used out of sight of the client. Stimulus books are designed to be stand up on the table, and the pages be flipped from the examiner's side to face the client. This book should be positioned so that the client is not able to see the examiner's side of the book as they contain the correct answers. The record form must also remain out of the client's view, for instance on a clipboard. Version 1 must be administered before version 2, and version 2 can be administered to observe change. The time it takes to administer is 25 to 30 minutes, approximately. There are 14 subtests in the RMBT-3. These assess aspects of visual, verbal recognition, and recall involved in immediate and delayed memory skills. The test also measures prospective memory, which is the ability to remember and carry out intended actions in the future, and the ability to learn new information using the novel task subtest. The subtests use the everyday memory tasks of remembering names, remembering hidden belongings, remembering an appointment, picture recognition, prose recall, recalling a short route, remembering an errand, orientation and date, face recognition, and learning a new skill. This assessment is associated with International Classification of Functioning Disability and Health domain of body function, specifically Category B1, mental function, and in particular Category B144, memory. The manual includes clear instructions on how to conduct each subtest with cues of appropriate prompts if the client is struggling with the task at hand. The subtests are separated into different conditions: presentation of the material, immediate recall, and delayed recall. The test should ideally be conducted in one session, with subtests conducted consecutively in this prescribed order. However, if the client appears distressed or fatigued during the test, a short rest break may be taken or brief conversation engaged in before proceeding with the next part of the assessment. The examiner must make an effort to establish and maintain rapport during the test and continue to praise and encourage the client's efforts throughout its administration. Now I will demonstrate the subtest of face recognition presentation. This subtest takes place in the 7th step of the test. The examiner should begin the subtest by saying, "Now I'm going to show you some faces. For each face, I want you to tell me if it is a man or a woman and if the person is over or under 40. This is to help you concentrate because later on I am going to show you some more faces and I want you to pick out the ones you have already seen." As I flip through these faces, you might like to try and remember them yourself. The examiner then presents each face for 3 seconds and remembers to ask whether the person in the photo is male or female and under or over 40 years of age. This is not recorded as it is the presentation stage of the task. If the client does not respond, within 3 seconds, proceed to the following face and give a reminder to make an appropriate response. After showing the faces, the examiner then proceeds to the root and messages subtest of immediate recall. After this, the subtest of face recognition, delayed recognition, takes place. The client is required to recognize the original 15 faces from a set of 30, including the 15 originals and 15 distractors. As I begin to show the 30 faces, you yourself can have a go at remembering the 15 faces I presented before. Before beginning this subtest, the examiner should tell the client, "Now we are going back to those faces I showed you earlier. For each face, I want you to tell me whether or not you saw this face earlier." The presentation is in an unpaced form, and the examiner should encourage the examinee to guess if he or she is unsure. In order to score the face recognition delayed recognition subtest, the number of faces misidentified are deducted from the number of original faces correctly identified. This number then makes up the subtest's raw score. Scoring. In order to properly score each subtest, instructions in the manual must be paid attention to. There is a raw score for each subtest. When the test is finished, you convert each raw score into a scaled score using Appendix B for version 1 and Appendix D for version 2. The table for the appropriate age band must be used, and in this instance, for Mrs. Mitchell, we would use the 75 to 89-year-old age band table to calculate her scaled scores. We would find the raw score in each subtest column and then read across to find the scaled score. The total of the scaled scores can then be used to plot the client's general memory index score, which represents the client's overall memory performance. Consult either version 1 for table C1, version 2, table E1. Percentile rank and confidence interval are also provided here. Scoring the subtest scaled score profile. Below the summary of scores on the record form is a subtest scaled scored profile. This table allows the examiner to plot the client's scaled score on the subtest level and compare their score to the maximum level for the age group. These scale scores represent how the client's everyday memory skills compare against the population averages in their age group for each subtest. The subtest columns are grouped into functional memory domains to aid in the interpretations of the scores. In summary, the final results should be disclosed to the client, and how the test impacts on future interventions should be discussed in consultation with them, while incorporating their own concerns and needs. The use of everyday tasks in the Rivermead Behavioural Memory Test demonstrates its ecological validity, as the test results are able to predict problems outside the test situation and indicate whether or not the person is affected by his or her memory difficulties in real life. In conclusion, the Rivermead Behavioural Memory Test provides an overall picture of the client's everyday memory skills, can highlight areas of cognitive impairment, aid in intervention plans, and can provide direction in areas of rehabilitation. Thank you.